Hi, I'm Dr. Frisella, and I wanted to make a short video talking about the rotator cuff and more specifically rotator cuff tears. The rotator cuff is a series of tendons inside the shoulder. The function of the rotator cuff is to help you lift your arm. As we get older, the rotator cuff gets weaker, it starts to fray. That's a natural process. And given enough time with wear and tear, it can actually start to wear all the way through and cause a tear. So a defect or a tear in the rotator cuff. Rotator cuff tears can also happen as the result of an injury. So you fall, you reach for something, something heavy is pulled down, you're trying to stop yourself from falling. Those are common ways to actually tear your rotator cuff. Often it's a combination of a tendon that's wearing over time and then an injury occurs and actually is the straw that broke the camel's back, which completely tears the rotator cuff. Rotator cuff tears can be small and less significant. We call those partial thickness tears, and those can often be managed just with physical therapy or an injection. If the tendon tear goes all the way through the tendon, we call that a full thickness tear. Full thickness tears can be small, medium, large, or massive, but they all have one thing in common, and that's full thickness tears do not heal on their own. We've done studies where we take patients with a tear all the way through one part of that tendon and look and see what happens over the course of time, and those tears never heal on their own. A certain percentage of them get larger with time. Most surgeons, myself included, would recommend that if you do have a full thickness tear of your rotator cuff, especially if it occurred as the result of an injury, that you have surgery to fix it. And the results of that surgery are generally very good. The point of doing that is to get the tendon to heal because we know that it won't heal without surgery. So hopefully that was helpful information. That's just a brief overview of what the rotator cuff is and what rotator cuff tears can be, and the idea that there's actually a broad spectrum of different types of tears, some of which can be managed or treated without surgery, and others surgery is probably the right thing to do. So thank you.